Diseases of the intestines in swine. These are atresia ani, intestinal torsion, rectal prolapse, hernia, ileus, intestinal dilation, constipation, and enteritis. For atresia ani, it's congenital. There's no perforation of the membrane, separating the endodermal hindgut and the ectodermal anal canal. It can be cured through operation. The differential diagnosis is a persistent meccal diverticulum, which causes strangulation of the intestines and which leads to no feces. For intestinal torsion, this can be caused by abnormal peristalsis or content, which leads to increased fermentation, or abnormal movements of the animals, or chronic peritonitis, which leads to adhesions in the abdominal cavity. And the differential diagnosis is hemorrhagic bowel disease, which causes a shock-like state. For rectal prolapse, there's a genetic predisposition. Enteritis and colitis can cause diarrhea, which leads to increased motility, as well as zearalenone mycotoxicosis, which these estrogens can cause perineal swelling and tenesmus, as well as pneumonia can cause coughing, and this leads to increased abdominal muscle contractions, or urolithasis in males, and constipation and tenesmus. This all causes increased abdominal muscle contractions, as well as pregnancy, which increases abdominal pressure. In pigs, hernias can be umbilical, inguinal, or perineal. And for ileus, it can be congenital, obstruction, compression, or paralytic ileus in the case of functional stenosis, or stricture ileus, which can be congenital, but in the case when it's acquired, it can be caused by an abscess, hematoma, tumor, or stria. For intestinal dilation in the case of megacolon, it can be primary or secondary. If it's primary, it's caused by a lack of mesenteric plexus. In pigs, it's called Hirschsprung disease, and this is when there's congenital missing nerves to the colon muscles. In secondary intestinal dilation, this is due to chronic proctitis, chronic peritonitis, or rectal prolapse. For constipation, it can occur in sows after farrowing or piglets with diarrhea or a lack of fibre. For the treatment, you give paraffin or magnesium sulfate. For enteritis, there can be secretory diarrhea, malabsorption, or inflammation. For secretory diarrhea, it's caused by E. coli. For malabsorption, it's caused by rotavirus, Isospora suis, and Lawsonia. And for inflammation, it's caused by Clostridium perfringens, Clostridium difficile, Salmonella, and Lawsonia. There could be catarrhal enteritis or colitis, bloody enteritis or colitis, membranous enteritis or colitis, and necrotic enteritis or colitis, or proliferative enteritis or colitis. The causes can be external or internal. If they're external, it can be from nutrition, plant toxins, mycotoxins, drugs, and pathogens. If they're internal, it can be from constipation and metabolic problems and dysbiosis. The signs are small bowel diarrhea and large bowel diarrhea. In small bowel diarrhea, we can see melena, undigested food, and there's a large amount of it. In large bowel diarrhea, there's mucus, fresh blood, and there's a small amount. For the treatment, give antibiotics in medicated feed, and it's after a resistance test. You do not give preventative antibiotics. Oral rehydration therapy is very important. It needs to have glucose, sodium, and glycine, as well as vaccinate them against Lawsonia intercellularis. Do not give zinc oxide as it's a growth promoter and was banned in 2022.